and welcome to this very special series where we showcase some of India's most valuable brands. And today's episode we start off with a company that's based out of Surat in Gujarat. Well, we are talking about SMT, that is Sehjanand Medical Technologies Private Limited, a leading developer and manufacturer of coronary stent systems and a company that promises to save millions of lives.
Sehjanand Medical Technologies, popularly known as SMT, is one of the largest medical stent manufacturers in the world, with a presence in over 65 countries. It is the leading developer and manufacturer of coronary stent systems in India. This Surat-based company commenced its operations in 1998. Within a couple of years of operational commencement, the R&D team successfully introduced India's first indigenously developed coronary stent system. Having established advanced R&D centers with a focus on safety and efficacy, SMT has been continuously improving and innovating stent design. This has helped physicians to place stents in the most challenging anatomies of patients. The driving force behind the company's exceptional growth chart is Bhargav Kotadia, the managing director of Sehjanand Group. After completing his education from Purdue University in 2011, Bhargav started working for Sehjanand Life Sciences, or SLS, where he developed the go-to market strategy for the company. By 2013, Bhargav deepened his involvement with the Sehjanand Group. Bhargav made his teams pursue product developments, cost efficiencies, and business growth. In the coming years, he plans to make SMT one of the leading cardiovascular device companies in the world. His dream is to make India the center of medical devices innovation and manufacturing for the global markets.
So your company has this philosophy, pledge to save millions. Please elaborate more on this.
The company, SMT particularly, was started by my father in 1998. At that point, he had already successfully built a technology company. And he was really becoming more and more conscious about where the economy, where the country is. And he could see that, we have a country and an economy that is starting to get stronger every day. It's picking up speed, but the critical access to critical healthcare was still a challenge. The common man could not afford the most necessary products or healthcare services. And on a particular night, he decided he wanted to address this, and essentially that was the birth of SMT. He had made plenty of money and wealth and fame in his earlier company, but really the purpose for this company was not to make money or fame. It was really to help the masses.
But to save lives.
By making critical healthcare accessible for all, and hence our motto since day one till today. It is pledged to save millions, and by that we mean millions of rupees for millions of people, and we believe we've been able to do that successfully so far, and we intend on continuing to do that.
SMT is a leading developer and manufacturer of coronary stent systems, and it also has a strong presence globally in 65 countries. Take us through your journey.
SMT has a heritage of precision engineering. Our previous company was into advanced manufacturing. So we're a very technically driven company. And what this allowed us to do is really focus on the product and the technology from day one. So SMT is the first indigenously developed Indian stent without any partnership, without any technical know-how previously. We developed it with a team completely Indian sitting here in Surat. But because we consider ourselves good at engineering, we were able to do that development from day one. And we had certainly a little bit of a catch-up to do because the industry had already been formed internationally and was already on the way. But we were able to catch up very quickly. So the company got started sometime in '98. By 2001, we already had our first commercial product. And around that time, a new technology called drug-eluting stents were already on the horizon.
Okay.
So again, we were catching up on that technology as well. But this time what we did is not only did we catch up to the drug-eluting stent, but we in fact innovated something called biodegradable polymer. which at the time was, and still today, it's one of the most breakthrough technologies that has been introduced in in the industry, because it allowed the drug-eluting stent to really overcome one of the biggest challenges it had in in the earlier days. So the company, I mean, an Indian company at a time when no one thought a stent could be manufactured in India, at that time, SMT became not only the first company to make a stent, but also while, at the same time introduce a technology that even the global majors were not able to produce. And this was sometime in 2004, 2005. We in fact went out and got a CE mark onto that technology. Again, it was the first in the industry, no one else had it. So essentially the first milestone, so to speak, was really getting the product right. At the end of the day, your entire business enterprise, everything revolves around the product. And we were able to get that right first and foremost by spending many engineering hours and millions of dollars in kind of getting that right. Once that was done, we really focused on our supply chain and manufacturing. And as over the 20-year history, really that's where almost our 10 to 12 years went, just getting the product and the manufacturing right. And with this, now I can honestly claim in front of you, we have one of the best stents in the world, at par with any of the global majors, whether it's coming from Europe, Japan, or US. Our product today can stand to the task with anyone. And because of this confidence, we in fact have an enormous clinical program. In India, we have one of the strongest clinical databases or clinical evidence out of any of the companies present in India. And we're now looking to build the same for us internationally as well, and international patients.
Okay then, and what factors in the past 3 to 4 years have helped the company strengthen its leadership position?
So once we've got the product right and the manufacturing scalability right, it enabled us to really focus on the commercial aspect, right? And that's where we really did a good enough job at listening to the customer. What is it that they wanted? And after hearing them out, what we decided to do is in fact really focus on our sales and distribution channel. So in India, we have a very unique distribution channel that in fact none of our competitors have. I think this was a really key strategic decision and move that's enabled and made possible the leadership position that we have. And aside from this, though we had been successful in producing the right technology and the right product early enough, in our industry, everything is empirical, right? It's not good enough that I say it's best in the world. The data has to say that. And more than any of the other players, especially in India, we focused on our clinical program at a very aggressive degree. In India, we have 10,000 plus patient data, as well as 2 years ago, we launched a marquee trial, and we're calling it Talent Trial in Europe, where we're studying almost our product in a randomized controlled fashion in about 1,500 patients. And this data will be out this September of 2018, which will again prove that the SMT stent is one of the best in the world.
So as the MD of SMT, it's obvious that you're very sensitive towards your customers' need, but what do you have to say about maintaining a balance between affordability and quality? Because you're here to save millions of lives, of people who are suffering from heart disease. So how do you make sure that it is affordable yet it's a quality product?
Excellent question. I think, first of all, the two are not exclusive to each other, right? Quality does not mean expensive. It's all about the approach that you bring to it, right? And especially being in India, first of all, and being at the kind of economics of scale that, let's say, SMT is at, affordability aspect is inherently easier to achieve, all right? Let's say versus if we were based in US or elsewhere. So once that piece is achieved, once scale and affordability is there, I think the really big focus is on quality. And to achieve quality for SMT or any other Indian manufacturers, I think the real focus simply needs to be how do we bring a culture of quality into the company. Once you start thinking from qualitative perspective all the time, then you'll be surprised what all factors or what all processes you can implement in your manufacturing, in your day-to-day operations. But I think the most critical aspect is that each and every team member, each and every employee of the company needs to understand what is the standard of quality that we want to adhere to, and why is it that we're adhering to that. Then it becomes really easy to uphold that quality even at a massive scale and affordable scale.
Well, on that note, let's take a short break, but another success story coming up on the other side, so stay tuned.